A fully functional EHR reports to both PhilHealth and DOH, as well as being able to generate the FHSIS report. North Bohol HCPN has a high EHR utilization and low functionalization rate.
Magandang umaga sa lahat. And today we're excited to bring you our fourth community-led webinar session, the IOL 201 Community Connect, leveraging electronic health records for UHC, key lessons from North Bohol. So please join me in welcoming an inspiring change maker and an active community member. We have Dr. Reina Juno Sumatra.
Hello, good morning to everyone. Bear with me if the structure is very academic. The Universal Healthcare Act of 2019 mandates that all health facilities are required to use interoperable electronic health records. The Department of Health has released an administrative order that requires province-wide health systems to have a functional EMR system. Now, let's first examine what are the differences between an EHR and an EMR. An EMR is a digital equivalent of paper records or charts. This is limited to a single facility, while the EHR is a person's electronic and longitudinal record of health encounters across several facilities over his lifetime. So, 5 years after the UHC has been enacted, Bohol's Info 1 has not yet achieved functional level. This leads us to the question, what are the facilitators and barriers towards the use and functionalization of EHR systems in the primary care facilities of the North Bohol Healthcare Provider Network? All 18 RHUs of the North Bohol HCPN are licensed PCF. So Bohol, as part of Region 7, has 2 HCPNs, the North and the South. This is the conceptual framework of this study. For the outputs or outcomes, we are looking at streamlined FHSIS reporting, improved PhilHealth claims, and stronger data management for both decision and policy making. All PCFs, that's 18 or 100%, in North Bohol exclusively use iClinicSys. This indicates a near universal utilization. Everyone in North Bohol is using iClinicSys. How about its function? Is it functional? A fully functional EHR reports to both PhilHealth and DOH, as well as being able to generate the FHSIS report. All 18 PCFs of North Bohol is at functionality level 2, which means it's still considered non-functional. However, there's one facility in Bohol that is able to use all features and is considered fully functional. For the key facilitators, this study found that the PCFs use their EHR because it is required by PhilHealth for claims processing. Next, peer support among staff has also been identified as a key facilitator. And finally, high-level buy-in and policy framework through MOAs and SP resolutions are also found in North Bohol. The key barriers are mostly related to system, technical limitations, as well as staff-related barriers. Interestingly, functional EHRs are part of the LGU Health Scorecard just this year, so LGUs really have an incentive to comply with their functional EHR systems. These are the challenges, limitations, and gaps in the current EHRs used by the North HCPN. When you're an EHR focal person, it's really hard to determine where in the process is the problem. Let me show you the in-car received signal levels that I was able to collect as I went around Bohol. The pattern reveals that good signal is only available at, you guessed it, the municipal centers. Usually near municipal halls, right? Like public market, churches, but otherwise, when you're farther from the center, no, signal usually is not available. If EHRs are supposed to work for barangay level services, we really need stronger ICT and internet infrastructure beyond the municipality centers. Because if the PCF themselves have unstable internet connectivity, they might try to use mobile data and still not be able to get the signal needed to be able to use their EHR. What we can find here for LGUs is that they can provide more ICT units, ensure stable connectivity, and make sure that at least the head of facility is properly trained. So combined, these steps can significantly raise user satisfaction and EHR functionality. Local and higher directives are not consistent. This further perpetuates the ambivalent transition, so further adds to the higher workload because of the redundancy of the work. There are still a lot of PCFs who do not have proper fund allocation for EHR implementation. Health facilities need to achieve self-sufficiency through adequate PhilHealth claims reimbursement, financing, and LGU support for the proper implementation of EHR systems. Otherwise, full functionalization will remain elusive. In conclusion, North Bohol HCPN has a high EHR utilization and low functionalization rates. And achieving full functionality will require a stable budget, updated local ordinances, ongoing training, and dedicated technical support. We need our leaders, our local chief executives, to fully understand the importance of having an interoperable and functional EHR system. Simply having a policy in place for compliance is not enough. It is very important to identify EHR champions for each facility to further strengthen good EHR culture and peer support. By aligning policy, strengthening ICT infrastructure, and sustaining training, we can truly leverage electronic health records for universal healthcare, transforming partial adoption into fully functional EHR system for North Bohol and the Philippines.
From the perspective of, let us say, the level of policy and decision making, what we actually foresee is something that will integrate all the reporting mechanism into just one system. I think very critical in terms of the design is yung telehealth services. Ang number one problem is the sector that will need, more telehealth services are actually those in the GDAS. But it is also in the GDAS where the infrastructure is not well developed. Maybe the system is at right now just a little more complex than, doing the TikTok and doing the Viber mentoring activities,
Probably a good would be to recommend what would be possibly the next set of indicators. Because as we know, the LHSML is good for the first phase of Universal Healthcare 2019 to 2025. The next phase we'll hear probably after the SONA later this month as to what the Department of Health would recommend to the President of the Philippines in terms of the UHC implementation. That means we will be moving into the next phase of UHC implementation post-2025. Interoperability starts with people. People need to be inclusive. If people don't talk, people are not compartmentalized. Their respective silos will be compartmentalized as well.
Our health system is in transition right now. We will not achieve universal health coverage overnight. But it is through these events where we come together, we agree to disagree, we debate, we argue, and then we come into consensus and start building the right systems for everyone to use. So thank you, Dr. Reina.
So that brings us to the end of today's session of IOL 201 Community Connect. See you next week. Bye! 1, 2, 3.